Respiratory protection for healthcare workers is a serious concern. The air you breathe on the job can, in some cases, cause serious infection or even death. Dust, particulates, and exposure to chemicals are hazards in many workplaces. But healthcare workers also routinely face the danger of airborne infectious agents. In the past, the most serious of these agents was tuberculosis, or TB. But recently, other infectious airborne hazards have grabbed the attention of infection control and safety professionals in healthcare facilities. These include the severe acute respiratory syndrome, or SARS, outbreak, and the current concern about avian and pandemic influenza. This video will provide OSHA-required employee training for the common respirator used for infectious respiratory hazards in healthcare facilities. It is also consistent with the Centers for Disease Control and Prevention and other OSHA recommendations specific to healthcare facilities for the prevention of infection from tuberculosis, avian, and pandemic influenza. Airborne transmission of infectious diseases occurs when an infected person expels or coughs small particles or droplet nuclei through the air. In the case of airborne spread diseases, such as TB, normal air currents can keep the particles airborne for prolonged periods and spread them throughout a room or building. Unlike TB, seasonal influenza virus does not spread over long distances. However, localized airborne transmission of influenza may occur over short distances, such as 3 to 6 feet, by either droplet nuclei or particles that are small enough to be inhaled, according to the CDC. With all types of influenza, nearby susceptible healthcare workers can inhale the airborne droplet nuclei and become infected unless they are wearing the appropriate respiratory protection. Healthcare facilities with workers at risk to TB and pandemic influenza must have a written evaluating and controlling such hazards in the workplace. A qualified person must be assigned to administer the plan, including selecting respirators for workers and training them according to OSHA standards. When respirators are needed for protection from TB and pandemic influenza, CDC infection control guidelines and OSHA respiratory protection standards require that healthcare workers wear fit-tested respirators certified by the National Institute of Occupational Safety and Health, or NIOSH, with a minimum N95 protection value. The N in the respirator designation means it is not resistant to oil, and 95 means the mask will filter out 95% of the air particles that the wearer inhales if fitted properly. N95 specification does not mean that all employees in a facility need to be provided with a respirator in training, only those with the potential for occupational exposure. Also, N95 is the minimum protection requirement. Some procedures or work conditions might require higher protection, such as N99 or N100 respirators. You can determine if your respirator is NIOSH certified by checking for the certification number found on the respirator filter, package, or enclosed product instruction sheet. This label also provides information about the features and limitations of the respirator. Employees must be familiar with these specifications before use. The respirator most commonly used in healthcare for protection from infectious diseases is the disposable N95 filtering face piece. It is an air purifying respirator, or APR, that uses filter material to provide protection against inhalation of small and large airborne particles. Disposable N95s come in a number of styles: cup, duckbill, fan fold, and flat fold. Disposable N95 respirators are sometimes confused with common surgical or examination masks. It is important not to confuse the use and user requirements of the two. Surgical masks provide protection against respiratory droplet spread diseases, but provide only limited protection against airborne spread diseases. The disposable N95 respirator is worn on the face and fits tightly to cover the nose and mouth. It does not protect against exposures from gases and vapors. Never use a disposable N95 filtering facepiece for protection from glutaraldehyde, formaldehyde, ethylene oxide, or other hazardous chemicals found in healthcare facilities. When fitting tightly over the nose and mouth, the disposable N95 respirator creates a protective seal to prevent any contaminants from leaking around the edges of the facepiece into the user's breathing air. A disposable N95 respirator must be individually fit tested to the wearer to determine proper size. This procedure must be conducted by a qualified tester, and the test takes approximately 30 minutes per worker. Your Respiratory Protection Program Administrator will arrange for initial and annual fit tests. Also, a fit test is required whenever changes occur in an employee's physical condition that could affect respirator fit. Such conditions identified by OSHA include, but are not limited to, facial hair, facial scarring, dental changes, cosmetic surgery, or an obvious change in body weight. User seal checks are different from fit tests, and OSHA requires them to be performed by employees whenever they put on a tight-fitting facepiece respirator such as an N95. A user seal check consists of a negative and positive pressure fit check. Secure ties or elastic bands at the middle of the head and neck, then fit the flexible band to the nose bridge. Adjust the facepiece snug to the face and below the chin. For the negative pressure check, gently inhale. Hold breath for a few seconds. The facepiece should collapse on the face and remain collapsed. For the positive pressure check, gently exhale. The facepiece should hold the positive pressure for a few seconds, and the employee should not hear or feel the air leaking out of the face-to-face piece seal. If the design of your NIOSH certified respirator does not permit the user seal check shown, then employees must perform user seal checks that are equally effective according to manufacturer's instructions. It is important to note that disposable N95 facepiece respirators must not be worn by employees who have facial hair that comes between the sealing surface of the facepiece. Respirators that do not rely on a tight face seal, such as a powered air purifying respirator or PAPR, may provide a more effective alternative. The PAPR uses a power source and a high-efficiency particulate air filter, or HEPA filter, to provide the wearer with filtered air supply. A hooded PAPR with HEPA filter provides a higher level of respiratory protection than the N95 filtering facepiece. The OSHA standard requires that employees inspect all respirators for proper functioning before each use and during cleaning and maintenance. Check for tears, holes, and obstructions on the facepiece, or loose connections on valves if used. Make sure the respirator has secure and properly configured head straps. You will probably be using additional personal protective equipment, or PPE, when wearing the respirator, such as gloves and even a gown and eye protection. To reduce the potential for exposure to infections, it is essential to follow the proper sequence when donning and removing PPE. The CDC recommended sequence for donning PPE is Step 1, gown. Step 2, respirator. Step 3, eye protection. Step 4, gloves. Pay close attention to this routine. Even experienced workers exhibit incorrect donning technique. According to the CDC study, 65% of healthcare workers improperly put on N95 respirators before entering patient rooms under isolation precautions. Errors included use of only one strap, incorrectly placed straps, and presence of facial hair. The proper sequence for removing PPE is Step 1, gloves. Step 2, eye protection. Step 3, Gown. Step 4. Respirator. The front of the respirator is considered contaminated. Do not touch it. Grasp the bottom, then top ties or elastics and remove. Be careful to avoid touching the nose or mouth when removing the respirator. Discard the respirator in a standard waste container. For the PPE removing sequence, it is important not to remove your respirator before leaving and closing the door to the contaminated area or patient room. Finally, remember to perform hand hygiene after removing PPE. Don't allow your respirator to dangle around your neck for later use. A new N95 respirator should be obtained for each new patient encounter. The CDC reports that this is a common misuse of respirators, and this is not only an infection control hazard, but also an OSHA violation. In the event of a pandemic situation, a sufficient supply of respirators may not be available. Healthcare facilities may permit reuse of disposable respirators as long as it has not been soiled or damaged and it retains its ability to function properly. OSHA reminds employers that definitive scientific data on reusing disposable respirators for infectious diseases is not available. As this practice may increase the potential for contamination, this risk must be balanced against the need to provide respiratory protection for healthcare workers. If a reuse policy is established, OSHA says that a disposable respirator should be limited to a single wearer. The respirator should be discarded if it becomes wet, torn, or the fit or seal is otherwise compromised in any way. When storing respirators, care must be taken to protect against damage, contamination, dust, sunlight, extreme temperatures, excessive moisture, and damaging chemicals. The facepiece and exhalation valve must be stored in a manner that will prevent deformation to maintain their protection effectiveness. Never store a respirator, or any PPE for that matter, under a sink. A respirator, even one as simple as a disposable N95, is subject to malfunction, such as breakthrough, facepiece leakage, improperly working valve, or torn straps. Should a malfunction occur, the employee should leave the respirator use area, inform the supervisor that the respirator is no longer functioning as intended, and replace the defective respirator or repair it before re-entering the contaminated area. Workers who require respirator use must be physically able to perform the work while using the respirator. And, according to OSHA, it is the employer's responsibility to ensure that employees are, quote, medically fit to tolerate the physical and psychological stress imposed by respirator use, as well as the physical stress originating from job and workplace conditions, end quote. The medical evaluation must occur prior to fit testing or first-time use of the respirator in the workplace, and it must be conducted by a physician or other licensed healthcare professional. But even after evaluation and training, workers may experience physical discomfort when using a respirator. Breathing through a respirator may require more effort than normal breathing. This may be a difficult or even prohibitive burden for workers while performing general duties or specific tasks. Be aware of labored breathing, increased heart rate, excessive or prolonged perspiration, and dizziness or lightheadedness. If you have a medical condition or physical limitation that may interfere with wearing the respirator selected for you, inform your supervisor. Your employer may require you to have an examination by a physician to determine if you are physically able to perform work while wearing that respirator. For compliance with the Respiratory Protection Standard, OSHA requires employee training before assignment to duties where respirator protection is needed, annually thereafter, and retraining when changes in the workplace or the type of respirator make previous training obsolete. The knowledge and skill necessary to use the respirator properly has not been retained by the employee, or any other situation arises in which retraining appears necessary to ensure safe respirator use. Respiratory infections are one of the top occupational hazards recognized by healthcare workers. Knowing how to use a respirator safely and adhering to that training during everyday work duties is an essential part of a respiratory protection program. A program that not only leads to successful infection control and prevention in your healthcare facility, but also one that keeps you, your family, and your patients healthy. Your Respiratory Protection Plan administrator may now choose to administer a test from the video's Education Resource and Tools package.